I know, but they were invited, right? Too long.
I'm not audio.
Are you ready? Okay, well, good morning, everybody. We're going to go ahead and get started with an update on a number of topics, and we're going to be taking some questions over the internet. So we're going to talk mostly about COVID-19 in the Albuquerque metro area today, but we're also going to touch on the chief search, which we provided an update on yesterday, and we're also going to talk about, of course, flu season and some other related topics. So I think first and foremost, want to let everyone know that the situation is unfortunately getting worse with respect to COVID-19 in the Albuquerque metro area. And basically, as a whole, what our folks and our Dr. Mark Demena is going to speak to this, we're feeling the sort of legacy effect of Labor Day weekend and also going back to school. But, our concern is really we're just building on very shaky ground as we go into the flu season. And so this is, I think, a difficult position as we go in to the rest of the fall. So as a general statistical point, our positivity rate has gone up from 2.4 to, I think, 3.4. And so this is, that's kind of the most important indicator of all the indicators. And so on a percentage basis, that's a very big increase. And so we are very concerned about that. It's still one of the lowest in the region, so that's good news. But again, the trend, the incremental increase is what we're concerned about. We also continue to see the biggest uptick in young folks, ages 20 to 39. And so we've got to remember that, we're just not out of the woods yet in terms of COVID-19. And until we see what the world looks like during winter and in flu season, we just need to continue to be vigilant with our social distancing, hand washing, mask wearing. This also means that a lot of city facilities are going to have to remain closed for a while. That includes Explora. It does include the aquarium, as we got clarification on that. It does include the convention center. And our other biopark facilities are going to remain open for now. But again, we are watching some of these statistics. Now, as we head into flu season, we also know, that it's really important everyone gets vaccinated for their flu shot. And so there's a number of things we're doing to try and make that available. We also know the symptoms for the flu are very similar, and we'll try and share some graphics. Actually, I remember last year when we first started doing this back in April, we had these graphics of like what's the flu and what's COVID. And so off the top of my head, there were some differences around dry cough and around loss of taste and so forth. So check with the State Department of Health, or those are pretty available just on the internet if you Google them to understand the differences. Now, we also know that as we set up for flu season in at least the Albuquerque metro area, flu season really hits kind of in the beginning of November. We want people to start getting vaccinated now. So October is the great time to get vaccinated. Flu season really hits in the beginning of November. We also know that a lot of our partners in the city are still waiting on their allocation for flu vaccinations. So I think you'll see in the second half of October, we'll be announcing a lot more locations and a lot of ways to get flu shots. There are some now, and we're going to share those with you in a little bit. But there's still plenty of time. Basically, just try and get your shot in October. We'll be in good shape, and there's going to be lots more ways to get that flu shot in the last 2 weeks of October. Now, we also know that there's different celebrations and holidays occurring. Obviously, if we think about whether it's Halloween, which we spoke about, please follow the CDC guidance for Halloween. And we also know, of course, Thanksgiving and the holidays are around the corner. And we're obviously going to be giving a lot more guidance as we get closer to those. But in general, it's just very important that gatherings try and be as small as possible, and that try and use masks and lots of hand washing. And if the weather's good, try and eat Thanksgiving outside. So we'll see what the weather looks like. But for us, we also know that this is a tough time for businesses because holiday shopping is going to start in November. And this is obviously the most important time for all our retailers. It's also a time when a lot of Burqueños tend to eat out, as with pretty much all year round, but it's also a tradition. in the fall and the winter as well. So there's a couple of things we want to touch on that are a little bit more specific to how we're handling outdoor dining. Now that the weather's getting colder, right? We've been saying have outdoor dining on your sidewalks, on your in your parking lot, even in the street. And we've been rolling out hundreds of thousands of dollars in funding to pay for those tents and accommodations. Now, there's a couple of things that have been happening. We want to remind folks specifically, now that it's getting colder, if you put all the walls down in your tent, then you are making it an indoor facility, which means you can only be at 25% occupancy instead of 75%. So it's very important that 3 sides must remain open if you want that 75% capacity. Otherwise, you got to close them and the capacity goes down to 25%. If you have questions on this, we really want all our businesses to call 311 or contact the Joint Information Center at 244-8676 or the state hotline at 833-551-0518. And they'll go over the protocols with you just to make sure that you're doing sort of the right thing and following the fire marshal's guidance and so forth. Another aspect, just as a reminder, do not, restaurants, put your heater, outdoor heater, underneath one of the tents. That is a big fire hazard, and so I understand that it's getting colder and so forth, but we just can't do that. That's a very dangerous idea. So we do want businesses to certainly invest in weather-related improvements, but we want to make sure they're safe. And so we want to continue, of course, to follow the public health order and enforce the public health order. We continue to have about 100 plus engagements and enforcement activities every week. So that is going on through our code enforcement, through our fire marshal's office, and also in some cases through the health inspectors from our environmental health department. Now, we are trying to also help businesses in a more direct way. And so you might remember that we did hand out about $1.8 million in grant funding to keep businesses from closing permanently. And City Council has worked with us and allocated an additional $10 million that we are working to hand out. And we have to get these dollars out by the end of the year. And so we're going to work on this process. By the end of the month, we should announce it. And in November and December, we'll start handing it out. There's lots of planning that goes on behind the scenes to make this happen, because we got to make sure it's fair and transparent. And we also hope that there's ways to fill some gaps for not only outdoor improvements, but also payroll and rent and utilities and even inventory and other different business expenses. So stay tuned for more on that in a couple of weeks, but help is on the way, at least from the City of Albuquerque, for businesses to the tune of $10 million. We also are providing PPE. This was another project that we've been working on, and now our local chambers are going to begin handing out free PPE to businesses. And you can get this by contacting the Albuquerque Chamber of Commerce, the Indian Pueblo Cultural Center, the Albuquerque Community Foundation, the South Valley Economic Development Center, and the West Central Community Development Corporation, and West Corp. And they will be able to pair you up with 11 local vendors who've been selected to make these PPEs for our community. And you do not need to be a member of these organizations if you want that PPE. So information on that is available on 311 and also on our website. And I think we'll have a specific event on that also pretty quick, meaning in the next week or so. Okay, now I want to hand it off to our own Dr. Mark Demena to talk a little bit more about some of these numbers and flu vaccinations. Dr. Demena?
Thank you, Mayor. As you just heard, and you've heard the governor talk about this, we are starting to see more over the last couple of weeks, some of the outcomes that we anticipated with the changes at the beginning of September. So, so used to this thing, I don't even notice anymore, sorry. We did expect that at the beginning of September, as there was some more gradual reopening, obviously a big Labor Day holiday, and we've seen the impact of holidays earlier in the year with Memorial Day and the 4th of July. We knew that there would be some cases to come out of that. And then not so much APS, but the rest of the state, there are students going back to school, and the family movement that comes around with that, just getting students, you know, the things that they need and getting them in and out of school every day. We did anticipate to see some new cases and some bumps, and we are seeing that. More or less, we're consistent with a level that is expected from that. It's not sound all the alarms yet. But every time we see an increase in those cases and in the spread rate, that's cause for concern. And as Mayor alluded to, the biggest thing that we're worried about is we are just getting ready to go into flu season, where we really expect as the cold weather comes in, people are going to have things like colds and flus already, and we're going to be worried about those illnesses, that's going to vastly impact the COVID transmission that we're seeing. We've talked about this before, but COVID and flu, they act on the same organ systems. They're both respiratory diseases. They both cause very similar symptoms. And we have every reason to believe that co-infection between COVID and flu can be very significant. Much worse outcomes, much more likely to make people very sick. On top of that, people that are very sick with flu, and flu is still a very serious illness as well. People that are sick with flu to the point of needing to be hospitalized are going to be tying up some of the exact same resources, ICU beds, hospital beds generally, even ventilators, that we want to make sure continue to be available for COVID patients. So if we get a big spike in COVID cases while we have a big spike in flu cases going into the season, that's a very significant problem. This goes back many months ago, but we've been talking all spring and summer and now into the fall about that flattening the curve concept, and that was always about making it so that the number of cases, the burden to the healthcare system was at a manageable level. We never said we were going to make the virus go away. We never said we were going to keep people from getting sick. We're just trying to manage the level of infection so that going into a hospital is not going to overstress those resources any more than we already have. In terms of the gating criteria that the state's talking about, our spread rate is up, not super significant in the metro area compared to some parts of the state, but it's there. Our new cases, our 7-day average of new cases is up. And as Mayor mentioned, the percent of the positivity rate for testing, that's a really good indicator. If you do more tests, but you have more people positive, it's reflected in that positivity rate. That's something that we watch really carefully, and that's up as well. 2% to 3% may not seem, 1%, what's the big deal? But when you're talking about a very low percentage, that's a significant change for us. So we are very concerned. We want people just to continue to do the things that we've been asking people to do. Now, as much as ever, it's going to be important. This is no time to relent on wearing masks, social distancing, being very conscientious about the things you really need to leave the house for. It's gotten easier as this has gone on to kind of forget about the severity of it and get back to going to the grocery store, going to the liquor store, going to the hardware store. And as things reopen, it sort of gives us this sense that it's safer now to do that. But that's not the case. If you're exposed to someone with the virus, you're just as likely to get sick from that person as you ever were. Nothing about the virus, nothing about the transmission rate has changed. So we need people just to continue to be safe, to be concerned about these things, and help us try to keep the spread and the transmission as low as possible going into what we expect will be the worst part of what has already been a terrible year. I would add, there's also nothing not serious about COVID. There's no reason to say don't be afraid of COVID. You should be very afraid. You should be very concerned. The numbers that we've seen all year around the country and around the world, it's very serious. In terms of the flu planning that's going on, because we feel this is so important and emphasizing again and again, we really want people to get their flu shot this year. For all the reasons I just mentioned, to try to lower the burden on the healthcare system and to prevent any serious consequences for yourself and others. The city is making a big push for our employees, but as Mayor talked about a few weeks ago, we're working with partners at the Immunization Coalition and some of the other hospital systems to try to set up as many opportunities for people to get a flu vaccine in the safest possible ways that we can. Right now, this time of year is when we really start pushing for flu vaccines, and a lot of the providers are just getting their allocations right now for what they're going to be able to provide. So we're making those arrangements every day. So far, UNM, the Geriatric Education and Health Maintenance Group, has been working on wellness checks and doing some free doses for seniors. There's one going on today that ends at about 1, and another one tomorrow, 9 to 1. That's today it's at the North Valley Senior Center. Tomorrow is at the Monsanto Multigen Center. We really would like people to take advantage of those while they can. In addition to that, as that comes down to a close, late in October, early in November, we just got confirmation today that the Department of Senior Affairs is going to be working with Albertsons to provide additional opportunities for vaccination for those with insurance. Information on that is all going to be on the city's website. This is one of the things that we're bringing to our partners is visibility and communication on this. So come to the city's website at cabq.gov/flu. find out about what's required for these events, where you can get vaccinated, and including whether or not insurance or what level of insurance is going to be required. And we'll show some more highlights of that, I think, down the road as more of this comes together. A couple of weeks ago, UNM did the first drive-through event of the season. The city helped in terms of marketing that, just pushing out the message on it, and they had a fantastic turnout. They had traffic out all the way into the street. So as we talked about a few weeks ago, that's a learning opportunity for us. If we know we're going to get this great a turnout, it's what we're hoping for, next time we can plan ahead for traffic control and taking up some of that, the surge in traffic that comes through, so it's not making everybody's day a little bit more miserable. We know that there's still resistance to getting flu vaccination among some people, whether they feel that it's just not safe to do so or they feel that it's not important. And that's one of the things that you hear us talking about over and over again this winter, is this is not the year to pass on the flu vaccine. And then just to touch on the last part of that, for parents in particular, the school system is going to be trying to get caught up on some of these vaccinations that are behind. And in particular, the school system, APS, for example, does a great job every year with getting flu vaccines to children. This year, without children in classes, it's going to be harder than ever to try to accomplish that. And we really want parents to think of ways to work with the schools and try to take advantage of the opportunities the schools are going to provide for those vaccines. It's just as important for your children. We're seeing a lot of COVID transmission in people between the ages of 20 and 40. And now, recently, the state has reported some deaths in that age group. There's no reason to believe that this is not something that affects people of all ages, and we really don't want to see those tragedies added to the tragedies we've already seen this year. So please continue to take this seriously. Get your children vaccinated, your seniors and your loved ones, help them get vaccinated against flu, and try to lower the negative outcomes that we might expect from that. Continue to be vigilant on COVID safety and prevention, and hold on for what might be a few rough months. This is far from over.
Okay, and let's, very helpful information, and I do want to mention too, there is an interactive map on our website, which we'll put a link up to on social media, that lists kind of the vaccination locations and some information. So for those of you tuning in online, we'll put that up, and it does get updated. So it's really a good kind of first check if you want to find out where you can get a flu shot. Shout outs to Duran's Pharmacy for giving my kids their first flu shot of the season. So I know a lot of other pharmacies all around town are already doing that. Now, a couple of items before we take some questions. Our civic engagement team has released this report. This is our first annual civic engagement report, and it's a real bright spot among the pandemic. It highlights some extraordinary efforts by our community to step up in a lot of different ways with volunteering. And so it documents 34,000 volunteer hours that have been logged in, which translates into an economic impact of almost $1 million. And so also the city was able to round up about 2,400 additional volunteers during the time of COVID and continuing. So there's all sorts of good information in here, including a list of all our One Albuquerque award winners. And so take a look at that report. It's available on our website. Just go to CABQ and type in civic engagement. Okay, now yesterday we also shared some information about our chief of police search, and I just want to summarize that for folks who might not have heard about it. We are, of course, casting a net across our country for a nationwide search, and that also includes, obviously, local folks and New Mexicans who might be interested, but we are certainly looking around the country as well. And we're looking for the right person, and we're also taking a lot of input from the community. So there are a number of ways that you can provide input. And so we want to hear from residents, we want to hear from advocates, we want to hear from neighborhoods, we want to hear from businesses, and everyone that has a stake in our public safety. And we know that fighting violent crime is our top priority. We also need a chief who's going to lean in to the reform process. And we also know that we need someone who's committed to continuing to building the ranks, as our police department still has a shortage, even though we've brought in 200 officers to date, hitting our targets. So there's lots to do, obviously, over at the police department, and we're looking for the right person for the job. Now, the job is posted on our city websites and a lot of the policing platforms. And we're also bringing in a specialist to help with this, a gentleman named Herb Crosby, who's, of course, lived in the metro area for several decades, and many folks know his track record. And he's taking a lot of the questions for prospective applicants. So if you're personally interested, if you have questions, please reach out to Herb at chiefsearch@cabq.gov. And we're also organizing different forums for people to provide input. Now, because of Corona, a lot of these are going to be virtual and so forth. But if you're interested in providing input, please email us at chiefsearchinput@cabq.gov. And Alicia Manzano, who I know is no stranger to our various briefings, is going to be leading that process. And we'll also be reaching out to almost 24 organizations who are involved in public safety in one way or another in our community to get their input as well. Now, we're going to handle this process similar to the way we did 2 years ago, and similar to the way we handled our city council process, in a sense that we're also organizing a search committee of city and community leaders that are going to help vet applicants and also conduct some interviews. So I think with that, we're off and running on that search. These searches sometimes can last very long. Last time it lasted 7 months. We're going to try and move a little faster than that, but they certainly last multiple months. And so we'll just see how many applicants come in, and then we'll have a better view in terms of what our timeline might look like for an actual decision. So we also want to allow enough time for plenty of community input. Now with that, I think we'll take questions if there are some.
We have a question from Ryan Laughlin with GOV-TV for Mayor Keller. With the uptick in cases and approaching flu season, is there any changes the city is considering for public health order enforcement or taking any additional measures to limit the spread?
So the question is really, with the increase in cases, are we taking any additional measures at this time to limit spread and so forth? And what I would say is that we are going to be more vigilant on enforcement. So we're going to be keeping, I think, a much more intense eye on enforcement, especially of social gatherings and so forth. But again, our enforcement efforts are aimed at compliance. So what you'll see is a fire marshal or a code inspector show up and work through, either if it's your business or your social gathering, and educate you on what the rules are. So we want to really step it up on the enforcement front, and then continue to look at our particular areas where we're concerned, especially whether it's nursing homes or whether it's restaurants. We'll see, but we are going to try and understand what's really driving those numbers here in our town. And I think the other thing is we had some plans to really push for things like Explora and so forth to open. And, you know, I think now we're just, as the state has recommended also, we're just going to wait and see for another few weeks before we even go down that path.
And now we have a question from Ryan for Dr. Mark DeMena. You said the goal is to manage the virus so we don't overwhelm hospitals. Hospitals have largely returned to normal operations. Do you believe the manageable number of hospitalizations we've seen is reason for using the restrictions under the public health order?
So I'll repeat the question. It's really about the number of hospitalizations, and is some of the good news around hospitalizations, you know, a reason to not have increasing concerns. So Dr. DeMena can field that, and what I'm going to do for you, Doctor, is just the situation reports are right there if you want to reference them.
Thank you, Mayor. In general, the hospital system has maintained excellent operations and stayed well within capacity throughout this so far. I don't think the changes in the public health order are necessarily suggested by that yet. I think the public health order is to thank for that. New Mexicans have done a good job in general of doing everything that they've been asked to do. The public health order has provided guidance back on track where we might have stepped out of line with that, and compliance-based enforcement that the mayor just talked about, trying to make sure people understand what we're asking them to do, is helping with that. Right now, in recent weeks, there's been a significant jump. You've heard the state talk about this in hospitalizations overall, about a 30% jump. So that, to me, does not indicate that it's time to take a more relaxed approach. If anything, it's a time to double down on what we've been doing. That's a significant increase already. And again, this is just leading up to cold and flu season. So as those kinds of things come more into play, and as the weather gets colder, and if we see an unexpected or an undesired increase in cases beyond that, we're going to need that hospital capacity to be available. So just as Mayor said, and I believe the governor has said it in the same way, we're still kind of waiting. We're in neutral. We've done some reopening to allow a little bit of a return to life, but it's not time to take any more additional steps yet until we see where we're headed with that.
Okay, I think actually we're clear on questions, and so I think we'll see a lot of folks tomorrow. We're doing a long overdue groundbreaking of a very big project in Martineztown. So, other than that, wish everyone to stay healthy and safe, and we'll talk to you soon. Thank you very much.